On the 23rd of March, the government imposed a nationwide lockdown. As the country ground to a halt, an invisible army of women continued their work, putting their lives at risk daily.
When the pandemic started, we formed the COVID Rapid Response Team, where we came together as a community to help people who are shielding at the time when the government said people need to be shielding, the vulnerable. So we came out because we have already exposed to the coronavirus working in the hospital. So I said, yes, this is an opportunity for me to make an impact in my community by helping those who really need us at this time. Because people were really, really anxious at the time because of the mixed messages people were getting, and there was no clear cut, even for us working in the NHS.
As a healthcare professional, I work full-time in hospital, and on my days off, I gave myself to support my community. And 80% of the members in this team were Southwark based.
Since the 16th of March, our NHS Angels have been carrying out weekly deliveries for residents from the Sierra Leonean diaspora, providing essentials, hot meals and collecting prescriptions for older members of the community. We're going to hear from the women who are the heartbeat and backbone of the community.
My name is Isaac Chalo, and I'm a nurse. I am quite heavily involved in my local community, doing lots of community cohesion work.
My name is Harriet Mustafa. I'm a staff nurse working at Chelsea and Westminster Hospital. I've worked for almost 11 years at Chelsea and Westminster. My main role is patient focused.
My name is Neymona Conte. I'm a senior staff nurse at Guy's Hospital, and I've been a nurse for over 15 years, and I enjoy doing it.
My name is Bintu Bangura. I work for King's College Hospital. I'm a renal nurse by background, and I'm currently the lead nurse for the anemia team at King's College Hospital.
It's been quite stressful. It's been very demanding. Over the last 15 years, I've been a clinical nurse specialist in palliative care, so that means I'm a frontline worker. So I've been working, continuously. Not really has had more than 1 week break since March, and it's been quite challenging.
During the pandemic, our ward was closed and we all moved into the ITU, where all of us were sent in to help with our colleagues in ITU to look after COVID patients. On entering into ITU on the first day, it was a bit emotional. Colleagues were crying after the first shift, and it was a bit emotional for me because I had to leave my kids. I was staying in a hotel after my 3 days long shift.
It has been very challenging as a nurse during the pandemic, and we've seen all sorts of things because we were in the heat of it during the pandemic because of the renal patients that we look after. They had the greatest impact during the COVID, so we will have to be redeployed to other areas to work, to look after these patients having the COVID virus.
Life has been really challenging through the pandemic because our expertise has been really needed at this point in time. In supporting the vulnerable and the elderly to healthcare professionals and those that have no recourse to public funds, we were supporting them as well during that point in time. And the slogan for the NHS is give support at a point of need, and I think that's where the rapid response come into play.
Ho, ho, ho.
Jingle bell, jingle all the way. What brings me joy is seeing other people who are around me happy. That's what brings me joy.
What brings me joy is spending Christmas with my family, and fond memories of Christmas have always been being around my family. And what brings me joy is seeing the children putting Secret Santa together.
I told them, this year we're not spending Christmas. And my son was like, Mommy, what? Then I said, then he asked me, Mommy, because of the corona? I said, well, that is one. And the other thing, I said, no, we'll hang up our trees and other things. But this time around, Christmas this year, we have to go out to give to people who have. So they've all accepted it.
Christmas is a wonderful time of the year, and what I'm going to miss this year is the work Christmas party, which is going to be different this year, and I really look forward to it, because as a team, because the nature of what we do, we always look forward to the end of Christmas party, which of course is not going to happen this year, but I would really love to spend the Christmas this year